Morning. I've been asked before we start to talk a little bit about COVID and the current status of COVID in our community. I was going to talk about COVID and a little bit about vaccines that everybody has so much controversy about. In our community, according to the BC CDC, and all this information is available online. If you go to the BC Centre for Disease Control, they've got a whole bunch of great graphs and descriptions of what's happening within our communities, as small as down to Grand Forks, West Boundary, Trail, all the different areas. And it can show you what the numbers are currently of the disease. They do weekly reports on that. They show graphs of what's happening. So if you're interested in looking and see what's going on in our communities, you can certainly see that. As of last week, the interior health cases peaked at about August 25th. And they measure them as per 100,000 people, and it was 75 per 100,000 in interior health, and it's now about 28.8. To put that in perspective, Northern Health is currently at 86.8. All the rest in our area are falling and are all now less than 28. The case rate per day is about 5 in 100,000 in vaccinated people, and about 50 in unvaccinated people. Unvaccinated cases older than 80, the case rate for some reason is at 137. It's really high right now. You're at least 10 times more likely to get the disease if you're unvaccinated. The case fatality rate is 10 to 20 times higher in unvaccinated people than it is in vaccinated people. So if you get COVID, the risk of dying from it is at least 10 to 20 times higher, and probably higher than that. Grand Forks cases peaked in August at about 60 per 100,000 and are now down to about 5 to 10, and it's been falling steadily. So what's happening in our community, we did have a real burst there, and it's really settling down now. It's much better than it was. Kettle Valley peaked at about 100 per 100,000, and it's now quite low. It had fallen off dramatically. They had an outbreak there as well. Vaccines. You hear lots about vaccines. Grand Forks, currently 73% of Grand Forks is double dosed and 79% is single dosed. Province-wide, we're at about 81% double dosed and I think 86% single dosed. So we're not far behind the province. Kettle Valley is at 65% and 72%. When you look at the vaccines, we have to consider what's called the risk-benefit ratio. What's the risk of the vaccine against the benefit of taking the vaccine? And unfortunately, and I think this has led to a lot of people's hesitancy in getting the vaccine, is a lot of the experts have said the vaccine's completely safe and there's no risk and you can take it without any problem. And that's just simply not true. The vaccine has a risk. The risk is very small. I have not heard of anybody who's died of the vaccine. There have been people hospitalized with the vaccine. There have been people who've been sick with the vaccine. What the vaccine seems to do, it really triggers your immune system to wake up and jump up. And if people have autoimmune diseases like Crohn's disease or rheumatoid arthritis or something like that, it tends to make that disease flare. Pericarditis and myocarditis are inflammatory reactions where your immune system is actually attacking your own heart to some degree. And we've seen that happen. Bell's palsy, which you may have heard of, and Guillain-Barré syndrome are quite rare nerve syndromes where your body attacks your nerve structures as well. And this has been seen at higher rates in vaccinated people than unvaccinated people. But because this is new and it takes time to accumulate the data, but we are accumulating lots of data on this. I mean, there's been like half a billion doses of this vaccine given around the world, so we're getting lots of data. But it takes a while to churn through all this data and understand exactly what's happening. But it would appear the risk of getting the vaccine, of having any sort of significant reaction, is probably around 1 in 50,000. So there is a risk there, but the risk is really small. The risk of anaphylaxis, of an acute allergic reaction to the vaccine, is almost zero unless you've had trouble before. People who've had flu shots or other vaccinations and have had significant reactions to those are the people we need to be aware of for getting allergic reactions. If you've had your other vaccines in the past, then the risk of having any serious reaction to these vaccines is virtually zero in terms of anaphylaxis and immediate allergic reaction. So you have to weigh out the risk of the vaccine, which, as I said, is about probably 1 in 50,000, and virtually 0% mortality rate from the vaccine itself, against the risk of dying of the vaccine. If you're older than 60 years old, your risk of death is somewhere around 1 to 2%. And it increases with risks. The major risks are pretty clear now, and they're any other concomitant disease. But age is number 1, obesity is number 2, diabetes, heart disease, renal disease, autoimmune disease, basically any concomitant disease. Of the people who die from COVID, they have an average of about 2.8 risk factors. So age and obesity and diabetes, for instance, with something called metabolic syndrome. And those are the people who are really succumbing to this illness. The other thing that's happening, especially in young people, and we see this, is young people, even with the flu, there's young people who occasionally die of the flu. I compare it to we all get stung by bees or wasps or things now and again, and most of us go, ow, and we get a bit of swelling and it goes away. Some people get stung by a bee or wasp when they fall to the ground and can die because they have a really significant reaction to it. There are some people, and including young people, who get COVID and are, for whatever reason, are really susceptible to it. And even if they're healthy and fit, they, like people who get stung with a bee or wasp, some people really don't do well with it. Aside from risk factors, there are people who just get sick from COVID because, for whatever reason, their system doesn't deal well with it. A lot of people talk about the pericarditis and myocarditis, which are heart inflammation reactions to the vaccine. Yes, there is a risk of that. The big American study came out about this. The risk of getting it is, as I said, quite low, and if you get it, it tends to be very mild and self-limited. It's not a permanent disease. It doesn't cause heart damage. It causes inflammation, which is irritating for a while. It's like getting a sore muscle from doing too much exercise. Well, it gets better, and it goes away, and your muscle goes back to normal, and that's what happens with this, with your heart. If you get COVID, however, the risk of getting pericarditis and myocarditis is probably 10 to 20 times higher than it is from getting the vaccine, and the risk of much more severe disease and permanent damage is significant if you get COVID. So again, you have what's the risk of the vaccine against what's the risk of not getting the vaccine. And the last thing I wanted to touch on is the RNA controversy. Is people are really worried about getting this injection of genetic material, of RNA. A very quick biology lesson. DNA is what structures our proteins and things like that. It's a template. It's the instruction system for your body. And your body basically goes to, if it needs a new protein, if it needs insulin, it goes to the DNA in your nucleus and makes messenger RNA from that. It makes a template of that DNA for the part that codes for insulin. And then it takes that RNA out of the nucleus and takes it to what's called your ribosomes, and the ribosomes manufacture insulin. It's a bit more complicated than that, but that's basically what happens. And the messenger RNA manufactures that protein. And what we've done is we've taken the messenger RNA for a part of the virus, of the COVID virus, and had it, and we put it in you, and then your body manufactures a little bit of that, what's called the spike protein. And that generates a reaction and makes you resistant to getting COVID disease. And that's how the vaccines work. That RNA is then destroyed. It's not incorporated into your cells. It doesn't become part of your body. It's destroyed after that. When you get COVID, you're getting that same RNA. You're getting that. We've just taken a piece of the RNA. The RNA code for the disease of COVID is much longer than that. We've just taken a little section of that for this one protein in the virus and had your body manufacture that so you can develop a reaction. When you get COVID, you're getting that piece of RNA plus a whole lot more RNA. This is relatively new technology. It's been used in people for about 10 years or so, but it's been under investigation for a good 20, 30 years. The other thing is people say, well, this is new. We don't get RNA in our system or DNA in our system, and that's not true. From the time you were born, even before you were born, if your mother got a virus, if you get a virus, you are getting an injection of either RNA or DNA. Viruses basically are little packages of RNA and DNA. and the virus gets in your system, and it unloads its RNA or DNA into your system, and it goes into your cells and basically tells your cells to make 1 billion of me. And the cells then manufacture more of the virus. And that cell dies and bursts and releases all that virus, and it process continues. And you cough out that virus and spread it to other people, things like that. But this is historic. We have been getting injections of RNA and DNA in our systems since the dinosaur days, since viruses first were born. So getting RNA and DNA is really a normal part of our lives. We're just giving it by a different fashion. And the last thing I want to talk about is masks. Masks. Study after study shows, and depending on the study, shows if you mask and distance, you reduce your risk of transmitting or getting COVID by about 50 to 80%, depending on the study. So it has a huge impact on the disease. So I encourage masking is really important because it really does lower your risk of getting it, and if you get it, of transmitting it. So, and the data is really clear on that, and there's lots of studies around the world on that. Okay, anybody have any quick questions or anything on? Mm-hmm.
Will there be an exam afterwards?
Yeah, we don't know why entirely, but if you get COVID, it confers some immunity. But the immunity, especially if you get mild disease, the immunity is fairly short-lived and not strong. And people who have had COVID can get it again and get it seriously again the second time. So the recommendation is to get the vaccine even if you've had COVID. Yes?
What about the controversy around third dosing?
The big controversy around third dosing is, again, it's risk-benefit. What's the risk of having a reaction to the third dose and things like that? Is it greater? We don't know that for sure. Yeah, it doesn't seem to be, but that's one of the controversies. And the other one is vast parts of the world haven't had the vaccine yet, and if the first world uses all the vaccines, then that's less for Nicaragua and all the other places in the world. So the data is kind of unclear. It's interesting that the big committee in the States, Biden was all ready to give everybody a third dose, and the big committee in the United States went against him and said, no, we don't need a third dose, except for high-risk people. So people over 60, people with significant other illness and things like that, a third dose is being recommended now. In Canada, we're giving it out in waves. The highest risk people are people who've had organ transplants and things like that. And the next highest risk people are people who have immune disorders and things like that. So they're giving it out in waves. They've already done it to the really high risk people, then they're doing it to the next risk people. And then the third dose is probably going to be given to everybody with any risk, people over 65, people with concomitant illness and things like that. And they're just getting to that wave now of people. And the third dose definitely bumps your immunity back up to like 95% is what the Pfizer studies are showing anyways. Moderna is probably the same.